I had a really great experience here. It was probably one of the highlights of my training was being able to run mindfulness-based groups here at the VCU Parkinson's and Movement Disorder Center. And these groups were for individuals with a Parkinson's diagnosis as well as their caregivers or family members. So they were mixed groups of both patients and caregivers. Basically a group-based format, and they ran for 8 weeks each group, and we would meet for about an hour and a half each week. And we would spend time in each class practicing different types of mindfulness skills, and so that included seated meditation practices, learning to pay attention to breathing as a way to sort of anchor into the present moment, and doing some chair yoga as a way of gaining body awareness. We'd also go outside on nice days and pay attention to things in the environment around us. We did some mindful walking. So there are lots of different ways to sort of train yourself to come into the present moment more often, and that was really the goal of the class. And then we spent a big portion of the class as well inviting people to share their experiences with trying to apply the practices in their daily lives. And in some ways that might have been the most important part, is that people were able to share their experiences and gain support from others in the group. We did look at outcomes because we wanted to know whether participation in the group was helpful. So we looked at changes in symptoms of anxiety, depression, and apathy. And we also looked at changes on some cognitive tests. So if you've been to our center and ever done neuropsychological testing or cognitive testing, those were some of the types of things that we looked at. And we were really encouraged to see that sort of across the board, people experienced improvements in terms of having fewer anxiety, depression, and apathy symptoms, and also improvements in their cognitive functioning. And that was particularly true. People had a significant change in their depression from the baseline to finishing the study. And then we also saw changes on a measure of verbal fluency, which is basically associated with your memory, how concepts are related to each other. And that maps onto a lot of different kind of everyday skills or aspects of your cognitive functioning. And so, again, that was really exciting to see some significant changes across the board. The sort of trend was towards improvement for people who participated in the groups. We did try to put together some resources on our website to help direct people, because a lot of the really good resources for getting started with mindfulness practice are available online. And we have a link through our resources on our website that lists some of the best resources that I think are available both online as well as in print. So there's some really great manuals and books that you can read to get you started. And we're also here, thinking about continuing with offering more mindfulness classes here potentially in the future, continuing our research, and also putting together a listserv for people who are interested in mindfulness. So those are all ways to get involved. I think probably the simplest thing is to try to develop and set aside maybe 5 or 10 minutes a day just to pay attention to your breathing as a way of anchoring into the present moment, and just kind of watching thoughts and feelings as they arise, as if you were just kind of a curious observer of your own experience, trying not to get so caught up in those thoughts and feelings, which is sort of our natural tendency.